Welcome to Her Health First, the podcast where Black women's health is centered, respected, and protected. I'm Traci. I'm a registered nurse, a healthcare advocate, and a woman who knows firsthand what it feels like to carry too much while navigating a system that was not built with us in mind. Here, we talk about real health, the physical, the emotional, the mental, and the systemic. We unpack what doctors don't always explain. We name what women are often dismissed for, and we learn how to advocate for ourselves without guilt or fear. This is your space to breathe, to learn, and to put your health first. Let's get into today's episode.
There's a very specific moment many women recognize. It's when you realize that you're overdue for care. Not just overdue as in, I should probably go in soon, but overdue as in months, sometimes years. And instead of urgency, what comes up first is guilt. You don't think, oh, let me go ahead and schedule that appointment. You think, I should have done it already. You think, they're going to judge me when I go in there and tell them how long it's been. You think, I don't even know where to start. That feeling is heavy. It sits in the chest. It tightens the throat. And for a lot of women, it quietly shuts down the whole process before it even begins. I hear this all the time in my patients. Women who apologize before they've even been seen. They explain themselves before anyone even asked a question. And then they're carrying shame because they were surviving instead of prioritizing appointments. What I want for us is to slow down right here because this matters. That feeling, it has a name. It's called medical guilt. And medical guilt is not a personal flaw. So where does medical guilt come from? Medical guilt doesn't appear out of nowhere. It grows inside systems that are difficult to navigate, emotionally unsafe, and often dismissive. Think about what healthcare asks of women. It asks you to schedule appointments during work hours. It asks you to understand complex instructions with very little explanation. It asks you to advocate for yourself in rooms where you already feel small. It asks you to trust systems that haven't always protected you. And when something falls through the cracks, the responsibility quietly shifts onto you. You're told you should have come in sooner. You're told you should have followed up. You're told you should have known. Over time, women internalize that message. Black women, this guilt is layered with something deeper. It's layered with the fear of not being believed. It's layered with the fear of being dismissed. And it's labeled with the fear of being labeled difficult or dramatic. So avoidance starts to feel a whole lot safer than vulnerability. Medical guilt is not about irresponsibility. It's about self-protection. Let's talk about what guilt actually does in the body because this is important. Guilt activates the stress response, the same pathways as fear. Cortisol rises, heart rate increases, breathing becomes shallow, and the nervous system moves into protection mode. When your body associates healthcare with shame, fear, or overwhelm, it remembers. Even if your mind says, I should go, your body might say, this isn't safe. So that's why so many women cancel appointments at the last minute. They freeze during the visits. They minimize symptoms once they're there and avoid opening lab results. We have to look at this not as laziness, but we need to look at it as what it is. This is nervous system memory. This is your body trying to protect you from the discomfort that it remembers. Because even though in our head we know we need to go to the doctor, we need to get our labs done, our body remembers the way we felt about it, and your body's trying to protect you. So medical guilt often sounds like, I don't even know what to say now. Or you may be thinking or wanted to say, oh, it's probably nothing. Or sometimes it sounds like, I'll wait and see if it gets worse. Or it may sound like, I don't want to waste anybody's time. And what makes this especially painful is that many women are incredibly responsible in every single other area in life. They show up for work, they show up for family, they show up for everyone else. But when it comes to ourselves, guilt convinces us that we've already failed. So we wait, and waiting feels easier than facing imagined judgment. So this is the most important reframe of the episode. You do not need to earn care. You don't need a perfect explanation. You don't need to justify the delay. You don't need to apologize for surviving. Here are some phrases that release guilt instead of feeding it. I haven't addressed this yet, and I'm ready now. I didn't have the capacity before, but I do today. I need help understanding the next steps. That's it. Full stop. No backstory required. And if a provider responds with judgment instead of care, that tells you something about the system, not about your work. So I want to offer you a moment of gentleness here. If you've been avoiding care, ask yourself, what made it feel unsafe to go before? What felt overwhelming? What support was missing? And you're asking yourself these questions not to blame yourself, but to understand yourself. You're asking these questions because starting today doesn't erase the past, it honors the present. You are allowed to re-enter care without punishment. You are allowed to start imperfectly. You are allowed to begin again.
Before you go, I want to remind you that your body is not the problem. Your questions are not too much, and your health deserves time, attention, and care. If today's episode resonated with you, share it with a woman who needs the reminder that she's not alone. And if you haven't already, follow the podcast so these conversations can continue showing up for you. Until next time, take a breath, take your time, and remember, her health comes first.